Welcome back. As over 40,000 people recover from running yesterday's marathon in central London, a new report published by the US Health Effects Institute claims 95% of the Earth's population today lives in an area where pollution exceeds air quality guidelines set by the World Health Organization. Joining me now from Boston, Massachusetts, is the president of the Health Effects Institute, Daniel Greenbaum. Daniel, welcome to Going Underground. Here in the UK, air pollution is linked to the deaths, apparently, of 5 people every hour. But your report says 95% of the world's population is breathing in dangerously polluted air. How did you arrive at such a figure?
Well, we are part of a larger global burden of disease effort that systematically looks at what the level of air pollution is in every corner of the earth. There are a series of studies that have been done throughout Europe and the UK, in the United States and Canada, as well as in Asia, that say that on an annual basis, the numbers of people dying prematurely due to air pollution is higher for those who live in the highest polluted areas. So that allows us to average across all of those studies to come up with an estimate of over 4 million people worldwide being affected by ambient air pollution.
Can you understand why there's some skepticism amongst the publics in OECD nations, given that governments told them to, for instance, buy diesel cars, and your report is again talking about the PM 2.5 particulates, obviously, which emanate from sources like diesel?
Well, in the case of diesel, particularly in Europe, is a bit of the classic case of the cart getting ahead of the horse. The technology was more fuel efficient. I know the European governments pushed to get more diesel engines, but they did that before newest technology, which is now available, that can dramatically reduce the emissions from diesel vehicles if they're operated properly. So unfortunately, unlike most of the rest of the world, Europe has a large number of diesel cars with substandard control systems on them.
I think what may surprise some people is the sources of funding for your institute. You're coming out with a report suggesting such a scale of air pollution when your institute is funded by BMW, Chrysler, Volkswagen, and so on. Is it difficult producing a report that seems to be so critical of arguably industrial capitalism and the motor vehicle industry whilst being funded by them?
Well, the Health Effects Institute's been around for 35 years. Yes, all of the car companies in the world contribute to us, but so do regulatory agencies, the European Commission we've done some things with, the US EPA is the biggest sponsor. And we have a well-deserved reputation for being very independent in our science. In fact, the toughest diesel rules in the world, the ones that were adopted in the US in 2000 for trucks and buses, were based on HEI science.
You mentioned the EPA. You're an EPA award winner, multiple award winner from the US Environmental Protection Agency. Have you noticed any changes under the Trump administration?
Well, there clearly are a lot of announcements that have been made about trying to cut the budgets, about trying to roll back some of the rules that were put in place in the previous administration. We work on a day-to-day basis with a lot of the people at the career level and even some of the new people. And much of that has not actually transpired yet. And we're working to get our science to inform those future decisions, as it has done in the past, as it's done no matter who's in power, to really support stronger and smarter regulation of air pollution.
Obviously, the EPA boss, Scott Pruitt, is in the news, but personnel in the EPA are casting doubts over clean air legislation. In the wake of your report, do you see any merits in trying to rip up clean air legislation in the United States?
Well, I don't think anybody, and I know Congress, will not consider undoing the Clean Air Act, the major law that we've had here since 1970. And in fact, the air programs for EPA have been fully funded by the U.S. Congress as recently as 3 weeks ago. So it's not clear to me that we're going to see wholesale ripping up of that. There may well be, and there is some effort to try and revise, to change some of the rules. And I think, and I hope that given the quality of the work that we do, that our science can help inform that, so the decisions are not made cavalierly, but are actually made based on the best science.
I presume you'd say this report is based on the best science. It's scientific, but of course, we know that the EPA chief said science shouldn't dictate policy in Washington, D.C. Can you understand that there are some forces in American public life who believe that the kinds of conclusions institutes like yours make are strangling industry?
Well, we certainly understand that there are people who are concerned about the science. Some of them actually turn to us to say, well, what really is the answer with the science? Because they know we have this track record of being a straight shooter organization. It's unfortunate if somebody stands up and says the science doesn't have a place in these kinds of decisions. I think that that's always been one of the misunderstandings here. I think well done science tells you we know there are effects at such and such a level of exposure in air or in water. And then there is a policy decision that has to be made. Is that enough to take action?
Daniel Greenbaum, thank you.